There are more than 200 different viruses that cause a common cold. The runny nose, sore throat, coughing, sneezing, and body aches we all know and hate for 7 to 10 days at a time. One of those common cold-causing viruses is respiratory syncytial virus, or RSV.
For adults, it's basically a cold, a bad cold. For children, especially small children, especially children that are at higher risk, like premature babies, babies with heart disease, babies with some sort of immunocompromised state, the RSV can lead to much severe respiratory complications, such as pneumonia, such as bronchiolitis. We often will see RSV bronchiolitis in the office during the winter season. What we see is a really bad cold, and the child is coughing, maybe breathing rapidly, and oftentimes in some sort of respiratory distress.
Call your pediatrician if your baby has a high fever, thick nasal discharge, a productive cough, trouble breathing, and is unusually lethargic or refusing to breastfeed or bottle feed.
There is significant variability in the symptoms of RSV. In most kids, it'll be a bad cold. And most children in the first year or two of their lives will get RSV. The parents won't know that it's RSV, the child won't know it's RSV, they'll just think that it's a cold. In the smaller subset of children, the RSV will be more severe. There'll be increased rate of breathing, there'll be very deep, tight coughs, there could be wheezing, there could be a little bit of a decrease in oxygen saturation of the blood. In some cases, the children could be in some type of respiratory distress and will have to be taken care of in the hospital. Most of the time, we could deal with it in the office.
It's usually unnecessary to determine if RSV is the cause of a cold, but for those children who are high risk or have other health conditions, a doctor can make a diagnosis with a test in the office. Unfortunately, even if the test is positive, there's not much more we can do about it. There's no specific treatment for RSV. Most can be managed at home. Children with severe infection may be hospitalized for respiratory support.
Sometimes RSV mimics some of the symptoms of asthma. And when it does, it sometimes will respond to asthma-like treatments, such as albuterol respiratory treatments. When it does respond, we're lucky because there's something we could do. Unfortunately, sometimes it doesn't respond to albuterol treatments. In those cases, we have to provide respiratory support and just general supportive care to the child. Maybe humidified air, a lot of fluids to keep the secretions nice and loose.
Most kids will recover in 1 to 2 weeks. However, even after recovery, those kids can continue to spread the virus for 1 to 3 weeks. Now, we're talking about really young children here, so teaching them to cover their coughs and sneezes isn't going to have much effect. So it's up to us adults and older kids to practice good hygiene and protect our littlest friends. Wash your hands frequently, especially after being in contact with someone with a cold or before handling an infant. Don't kiss a baby if you have cold symptoms. Keep your baby away from crowds and other people with a cold if at all possible. Clean and disinfect hard surfaces, such as doorknobs. I know. You don't want to be the crazy, overprotective new parent disinfecting everything and everyone who comes near your kid, but that's probably better than dealing with a hospital visit, right? I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.